A lot of important components to our anatomy are shown here, going from the immune system with the tonsils to the respiratory system to the digestive system. So I want to highlight, and I'm gonna kind of mix it as I go here, but I do my best to highlight these. So what you have here is the frontal sinus. So this is your frontal bone. You've got your sphenoid sinus here. So talking a little bit about the respiratory system, those sinuses are going to contribute to resonance of your voice, something we can all appreciate when the sinuses are infected when we're sick. Here we've got the conchae. You've got the superior, middle, and inferior. These create turbulence. When you take in air through your nose, they allow for that air to kind of do this as it comes in, and that forces more of that air to come into contact with the mucous membranes, with all of our cilia that help to sweep and clean that air. This is going to be your uvula. So your uvula, if you open wide and look back at your throat, this is what you see hanging down. So when we swallow, the uvula actually rises and creates a little bit of a seal so that the food doesn't go up into our nasopharynx. So if you've ever experienced getting something up your nose while you're laughing and eating at the same time, it's because that uvula hasn't sealed properly and a little bit of that liquid has gone up here. So I alluded to the name nasopharynx, and I wanted to talk about the three components of the pharynx. So if you look, this uvula creates a divide more or less between the nasopharynx, so at the back of the nasal cavity, and the oropharynx. This is your epiglottis. I oftentimes see students mix the epiglottis and the uvula. The epiglottis is the guardian of our airway. So this is going down into your trachea, and then just posterior to your trachea, this is your esophagus. So when we swallow food, another important thing, flap that closes, if you will, this is elastic cartilage, but it's gonna come down and it's gonna prevent that food from going into your trachea and forcing it down into the esophagus. Zooming in a little bit closer, so from the uvula to the epiglottis, this is your oropharynx back here. So the laryngopharynx is gonna be this region. And here you're gonna also have your vocal cords. So true vocal cords are the ones that are shown in white, and the false vocal cords are shown in pink. That's largely because the true vocal cords don't actually have a blood supply, so they do have a white appearance to them. But that's your voice box, if you will. If you consider laryngitis, that's an inflammation of this region. Epiglottis, glottis, laryngopharynx with your vocal cords, esophagus back here. I want to turn now and address some of the immune features that you're seeing, and it's predominantly going to be our tonsils. So the palatine tonsil, you want to think palate. So that's going to be this one here. It's going to be your palatine tonsil. Coming here, this is going to be your pharyngeal tonsil. And then the other one that you need to know is the lingual tonsil, which has a bit of a different texture on these models, but this is supposed to be your lingual tonsil. Getting into the endocrine system, just because it's a cool view of this, this is your pituitary gland here. So this is that sella turcica of your sphenoid bone, and it's going to sit in that little pocket. Pineal gland is going to be, so this is your cerebellum. This is going to be your superior and inferior colliculi, and this is going to be your pineal gland right here. Other side, you've got a really nice view of our salivary glands, or at least two of the major ones. So this is your parotid salivary gland here. Remember, it's an exocrine gland, and a couple of the distinctions with an endocrine gland, you're dealing with hormones being released into the blood. With an exocrine gland, they have ducts, and those ducts are going to carry secretions. And so in this case, with the parotid gland, of course, what we're secreting through here is going to be saliva into the mouth. And then coming down here, you can see this other salivary gland just underneath our masseter bone, our submandibular salivary gland. We also have a sublingual salivary gland, which isn't shown terribly well in these models, but it's just sublingual, right? So it's just going to be underneath the tongue.